Good evening and welcome back to our Career Conversations. We're so glad you chose to spend the evening with us. My name is Darla Burton and I'm the Director of Recruitment at Mary Washington Healthcare, and I will be your voice this evening. Tonight, we want to focus our conversation on the opportunities available throughout our surgical suites. We have assembled an astute panel to share their background and experience in working in one of our Mary Washington and Stafford hospitals. Tricia Boring, RNFA, is a nurse manager at Mary Washington Hospital. She's been with Mary Washington Hospital since 1989 when she began as a transcriptionist and has worked her way through her associate degree and on to obtain her bachelor's and is working at Mary Washington. Hillary Elliott Sullivan is also an RNFA. She's a nurse manager at Stafford, whose passion was originally in ballet, and she says nursing, just as in ballet, is an art form that takes skill and discipline. She has been at Stafford since 2017. And last but not least, Stephen Mitchell, RNFA, is a U.S. Army Reserve veteran. He came to Mary Washington in 1997 as a traveler surgical tech, and in 1998 became an associate of our healthcare system and has been here ever since. Please keep in mind this Facebook Live event is a career conversation. Please join our discussion by submitting questions either through the message portal or through the contact page. We are trying to respond to all questions live. However, if we're unable to reply during the event, we will respond later via Facebook, and we appreciate your patience during our technical difficulties. Now, we're going to kick it off and pass the conversation to Tricia.
Hi, good evening and welcome. Mary Washington is a Level 2 trauma center located in Fredericksburg, Virginia, and has recently been redesignated as a magnet facility. We have 447 beds, 15 ORs in the main building.
Stafford Hospital is Mary Washington Hospital's sister hospital down the road. We are a 100-bed hospital. We have 4 ORs, and we are located in Stafford, Virginia.
Just like Darla said, yes, I was reservist, retired, 24 years served. Started out here as a traveler in 97, came permanent in 98, joined the cardiac team in 2000. I've been working on the cardiac team ever since, got my RNFA, harvest leg vein for the open heart team, and assist with the TAVR programs, which is our new program that we do here at Mary Washington Hospital.
What kind of shifts do we offer here within the organization? Hillary, what do you offer at Stafford?
At Stafford, we are a community hospital, so we offer from 7:30 to 1700. We do have operations that do go past that, and it's when we use our call teams. But we usually have our staff scheduled from 7:30 to 1700. We do all ranges of surgeries. The only thing we don't do at Stafford
Night, we offer 8s, 10s, and 12s. We also are interested in part-time as well as PRN associates. Our call does vary based on the number of staff that we have. We have 1 to 2 hours of call versus 10 to 12 hours of call.
Our call shifts do differ between the two facilities. We have full-time, part-time, and PRN at Stafford as well.
Great. How about in the heart room, Steve?
Cardiac is a little bit different. We take a ton of call, but our shifts are 8-hour shifts, 5 days a week, and that's pretty much it. I mean, it's simple to the point, you know. So.
Okay, absolutely.
Just play the ORs.
Yeah,
Yep.
simple.
Talk about some of the specialized teams that we have in the OR. At Mary Washington, we recently have acquired an XI robot. We also perform minimally invasive anterior hip surgery. We also have a few cancer center doctors within microseed breast therapy. We do prostate radiation, as well as a new surgical oncologist arriving in late June.
At Stafford, we are a COMEG certified hospital, which is minimally invasive gynecological surgery. So we've had that designation for the 3rd year, so very excited about that. We also do orthopedics, anterior hips, and plastics. Like I said, everything but neuro and cardiac. It is a smaller group there, but a very exciting group. We don't have teams. Everybody does everything, which makes it a variety that everybody keeps up their skill set.
Sure. We have specialty teams in the OR at Mary Wash because of the complexity of the cases, but we primarily have a primary team and a secondary team. We do neuro, lots of ortho, GYN, ENT, general urology, podiatry, thoracic, and of course cardiac.
Cardiac as well, yeah. So we do a lot of complex cardiac cases, open valve cases, aneurysms, dissections, of course, CABG, so it's exciting.
Great, great.
At Stafford, the same, it's growing. The area for Stafford is also booming. Both hospitals are located in between Richmond and DC, so it's now actually becoming a suburb between the two areas. So Stafford especially is growing, so the hospital itself is growing. The volumes there is growing, and the community has the opportunity, of course, later on here to expand. I know that the facility itself can also expand and grow into some more beds as well for that facility. So the growth for Stafford is just not there with the medium size that we have our designation for. It can go further. So the opportunities there are pretty much endless, and it's very exciting. So I can't wait to see how that turns out. So yeah,
Great.
Very much so.
Yep. How about how does a person get into the OR that doesn't have experience in the OR?
Well, what we've been doing since I've come, and I know at one point in time, I know Mary Wash was also doing it, was the Peri-Op 101 program through AORN. And we have teamed up and actually had a collaborative between all our facilities. And we do take new grads, and we work with them and experienced nurses from other departments. And we put them through a 9 to 12-month training program. It's 3 months of a didactic portion, and then the rest of it from 6 months on to a year is your clinical portion between our facilities, either Stafford, if we have the openings, Mary Washington have the openings, and our other facility, FASI, our outpatient day surgery center. And this is where we train you to be an OR nurse. And so if you have that passion and that want to come and be an OR nurse, these are these opportunities to take, because back, I guess in the day, it was very hard to get into the OR, and nowadays it's the calling for people to want to do it. For the OR is coming out more and more. So this is the opportunity to do so. So this program, which is called Peri-Op 101, is very exciting, and it's hands-on, and actually it's gets you involved. So it's a great program, and we do offer that here at Mary Wash.
Great. It's a great program. I actually did the program myself in the late 90s, and very successful. The program that we just did this year, we have 2 students here at Mary Wash. You have 1 student at Stafford.
That's correct.
1 student at FASC. It was a collaborative effort between the 3 facilities underneath Mary Washington Healthcare's umbrella for a successful outcome of 4 students.
That's correct.
We do have a question from our listeners.
Great.
Do we allow CFA students to do clinicals in our facilities?
Certified First Assists. It all depends on the contract that the school has with our healthcare facility. If they are the agreement that the school has, then yes.
So I think they simply need to reach out to us here on the Facebook page or at the phone number that you've listed to talk about a opportunity, because we have multiple schools with surgical techs, RM programs, and I think we would definitely entertain that opportunity.
Fantastic, thank you. Another question is, are we offering opportunities at the Surgery Center, and how many beds and OR suites that we have? So
At the surgery center? At FASI?
I believe that's what
Fredericksburg
they're
Ambulatory,
Okay, I just wanna
Fredericksburg Ambulatory Surgery.
I would believe they currently have positions. I'd have to look at the hospital website. And how many ORs do they have? I'm going to say, I don't know for sure.
I don't know for
but,
sure how many.
Yeah. I'd say probably between 8 and 10. That's just a guess.
I think you're probably right.
Any other
Our
questions?
next question. Would you take new grads in any of our OR settings?
Absolutely, but they would definitely go through the Peri-Op 101 program.
Mary Washington as well?
Absolutely.
Perfect. Next question. One of our listeners has asked about weekend shifts, so you might want to address, because
Absolutely.
we've had several
Yep, very
questions
good
about
question.
that.
We currently in the main OR at Mary Wash, we operate 2 rooms on Saturday and Sunday with a call team as a backup. Those procedures on Saturday and Sunday are inpatient only. They're not outpatient or elective procedures. They're inpatient procedures. We currently have a position open for surgical tech?
For Stafford runs the weekends by call team only. We do not have scheduled shift on the weekend. That is run for emergent
Cases pooled.
Our cases are pulled based off doctor preference sheets, and they're pulled in the basement, I want to say, but down in CSR, and then they're brought up on the case card system with the pack, the instruments, the doctor's preference card, and then if the night team isn't busy, they go ahead and pick all the small stuff that goes with those procedures. And that's how our cases are pulled here at Mary Washington Hospital.
At Stafford, it's somewhat the same process, except for we have an OR support associate that we pull the DPCs, the doctor's preference cards, they pull the case cards, they pull the supplies, and it's in a collaborative efforts with CSR for the instrumentation. At Stafford, it's a collaborative effort. Since it is a smaller unit, everybody chips in and does everything, so everybody has their skill set.
Good.
I think you've addressed this a little bit, but we've had further questions about the type of cases that you offer, and are there differences between the two facilities, Mary Washington and Stafford?
I think there are some differences and very similarities as well. The difference is that we do more complex thoracic, neuro procedures, craniotomies, spine procedures. We do a lot of total joints, but I think that's pretty similar to yours.
Yes.
But our volume's a little bit higher than yours. We have 4 very active total joint surgeons in your facility, and then we do your typical general GYN, podiatry kind of cases.
Yes, we do have orthopedics, total joints. We do orthotrauma. We have the typical GYN cases, again, with the minimally invasive COMEG certification. We also do plastics with the reconstruction and urology, the podiatry, general, of course, all the general surgery, and vascular, the carotids and the fempops. So pretty much, like I said, pretty much the same thing except for the robots and the neuro.
Sure.
And the cardiac.
Yep, and cardiac.
Mm-hmm.
Yep.
Another question is, do we cross-train between the specialties?
Well, at Stafford, everybody is cross-trained. Everybody does everything. So it's not in silos of just working on one service line. Due to the fact of the size, is if you might be doing orthopedics one day, you could be doing GYN the next, or you actually could be doing orthopedics for a couple of cases, GYN next case, general and next case. That's the beauty of this smaller institution with the 4 operating rooms, because again, it's a variety, and you're able to, jump from one specialty to another. Then the difference of being where Mary Wash, because it is the larger facility, that they do have their specialized teams.
We do have a complexity of teams, and typically our staff will have one primary team and then a secondary team. But when we're on call, we cover all services with the exclusion of cardiac. What we typically do whenever a new staff member arrives, we kind of evaluate their strengths and weaknesses, look where the needs of the department are, and try to marry those together so that we have interest from both sides to meet the needs of what we need for the patients.
Okay. Do you have a period of time when you offer the peri-op program? Is it defined annually, or do you just offer it as needed?
The way it had run the past 2 times that I had offered it had been around the September and January, because that was based on the need. So it seems to be kind of like biannual at this time, which has been usually what institutions do, because that's how it's been running with OR staffing, I guess, across the country, you can say.
Yes, I agree.
Okay. Thank you. We've had someone ask us to talk a little bit about how we build the team in the OR and what the team looks like and what you're looking for when you're identifying new team members.
Okay. We're looking for people who are energetic, who handle stress very well, because it is a high stress environment, so a lot of times you need to bring a little bit of humor into the situation, because when you see sick patients day in and day out, it can be a little stressful. So we try to lighten the mood in the situation that you're through. We're looking for self-starters, motivated people, but people who like to work and get along well with others, because once again, there are days when it's stressful, when we're not necessarily nice to each other, because of the stress that we're in, but realizing that that's why we sometimes can be a little grouchy is because you're in that stressful environment. So self-starters, motivated people, and of course a skill mix and a sincere desire to want to work.
One of the things about the OR that I have to say, it's really a passion. You have somebody's life that you are their advocate for. You are their voice. You are there to take care of them. They are totally relying on you. As the circulating nurse or as the scrub nurse, it is your responsibility to make sure that everything's going to come out to the best of your ability. So the person that we want is somebody who has this passion that wants to be there and has this going forward and wants to put their all into it. This is not just really the job to do, well, I'm going to punch in, I'm going to punch out. It is something, it is a calling, it is something that you want to be there for. You have to rely on your team members. It can't be done just by one person. The circulating nurse has to be able to rely on the tech has to be able to rely on the assist has to be able to rely back on the circulating nurse, and most of all, the surgeon has to be able to rely on all those team members. And it's a collaborative effort. And at the end of the day, it can be very, very exhausting, but it can also be very, very rewarding knowing that this person, you have pulled out cancer, you have fixed a broken bone, you have helped, with a prognosis to be able to, tell them that on one of those times you don't ever get to see what happens to the patients afterwards. But there are times you do get that information, and when you do, you're like, I was a part of that. I did that. And especially with cardiac though too, it's life-changing, and things can change at a drop of a hat, and you've got to be able to respond, but you've got to be able to respond in a way where you can think on your feet and be able to go at a moment's notice. And it's a very different type of nursing. So those are the people that we're looking for.
Yes, very much so.
How is the working relationship between nursing, surgeons, and anesthesia?
We work collaboratively together. There are times when you're seeing something from a different perspective from your anesthesia provider or your surgeon, but it's also a respectful environment. There are days when I've given advice to the surgeon on something that he hadn't seen. We work very closely together. I often say it's an intimate family. We stand shoulder to shoulder, change a thing in this place. It's a wonderful place to be. The surgeon's very talented. We do some very talented technological procedures in the organization. The team I sit with here today, I'm very proud to be a part of this team in the organization. And we welcome other members to expand our team because we continue to grow to support our community. Is very rewarding, like Hillary said as well.
I agree with Tricia. It's very much a collaborative effort with the surgeons and the anesthesiologists and other team members. Again, as I was saying before, you have to be able to have that communication skill with them. Sometimes everybody's not going to agree with everybody, but you have to be able to work with that. People are like, whoa, I don't want to be involved in that, but you have to be able to. So again, it's a collaborative effort.
Yeah, it's nice to see because you see the doctors working together for the greater good of the patient. So that's the outcome we're looking for, is positive outcome for our patients here in our community.
Absolutely.
That's the end game.
Yeah.
Absolutely.
So Stephen.
Yes.
Stephen, since you're on a roll here, we have a question for you. So you've been at Mary Washington for a while, so talk about what you like best about working with our organization.
Well, like you said, new start kind of thing. So you knew what you had on the table as a tech. For me, that was important because I worked some other places around the country that weren't like that. So for me, that's one of the reasons that made me stay here in Fredericksburg.
Not just reading the chart.
Right.
No.
Yeah.
Right.
Hillary, have you discussed why you chose Fredericksburg? I know we relocated you here in 2017.
Yes. I was actually working up in D.C., but my family was in Virginia Beach. So I have special needs children. So to me, it was important that I found a place that was, one, inviting to me, and two, that supported me in my skill set and my mission. And that's how also the healthcare system here my values aligned with theirs. And it was special. It was special. I remember when I left my interview, the first thing that I did, I got in my car and I called my mom. And I was like, this is it. I was like, this is home. And I had worked in big facilities, level 1 trauma centers, academia for umpteen years. Trauma, complex spine. I did very scary, but one of the best decisions that I ever did. And the group of people that I came to work with made the difference.
Absolutely.
That is what made the difference to me. And it was, I can't explain it. So I uprooted everybody and moved them and brought my whole family back together. And here we are.
Cool.
Yeah, very nice.
One of our participants responds, I saw in the paper your cardiac program is in the top 50 in the country.
Yay.
How many doctors do we support in that program? Do you all know that number?
Well, there's three open heart surgeons here, Dr. Strower, Dr. Cardone, and Dr. Knob. And there's a vast many of a hospital size in the country as well. So we went up against the big dogs, we're in the top 50, but we were the third best based on our size of the hospital.
Absolutely.
So it's very, very rewarding to see, very rewarding.
What positions would be available to someone that's looking to work in the OR besides RNs? What other positions are out there?
We have quite a few outside of RNs. We have first assist positions, we have surgical technologist positions, we have support associate positions. They're all posted on our website. Just give it a look and come in and apply.
What does a support associate, what's their role in the OR?
It's just as important as everybody else in the hospital, especially in the operating room. They help with turnover cases, they help getting special equipment, they bring patients down, they run labs to the lab for us, that kind of stuff. So they're a very vital portion of what we do in Mary Washington.
Another very important role is a CSR techs for central sterile reprocessing. Those are actually the pillars for the operating room. They help with the reprocessing of the surgical instrumentation. And we do have a program also set in place that we are working on to do in-house training for people who haven't actually had a lot of training in that area. So we are working on that program. So again, we have those opportunities as well, because we can't do surgery without that. So that is a pillar for the operating room. So that is another ancillary job for the operating room as well. Very much part of the family and very much a needed role.
Hillary, that in-house program you're offering, are they going to be a chance to get certified as well?
I believe yes.
Yeah, that'd be great. That'd be great.
That's great.
Any last things you would like to say as we wrap up this evening's session?
Oh, we're talking about certifications. One thing that I do know, Mary Wash does support for nurses as well, and even though techs do come to us with their certification, surgical technologists come to us with their certification for the nurses here for their CNO, our Certified Nurse Operating Room, which is part of a clinical ladder that I know we're working on for our nurses, so that's a good thing as well, because we definitely want to become, CNO are strong, so that's a great program that we do have.
Yep. And the organization does help with the initial certification fees as well.
Yeah, they do.
And we're helping to create a clinical ladder for surgical techs as well.
I like to say, if you're tired of driving up and down 95, this is a great place to work.
Yes.
The commute is not as long. You'll be home a lot earlier than you would if
It's
you're
the
working.
first time I'd probably say in years that I think
Yes.
I've lived with 10 minutes with
Yes.
my house.
We're a great surgical family. We really are here for each other, support each other, celebrate a lot of events together, and really provide great care, but as a family.
Yeah.
Wow, thank you guys very much for your time this evening. There are some additional questions that have been posted on our Facebook page, and the video will be available for others to view. So if, even as our leaders in this organization, if you wouldn't mind logging in and responding to some of the questions about shifts, etc.
Okay, sure.
that would be fantastic. And to our audience, thank you so much for joining us this evening. We do have another Facebook Live planned. It is on August 13th. We are going to discuss the staffing office and different opportunities that are including RNs, CNAs, transport, patient safety attendants. So details will be posted on both the Mary Washington Healthcare page as well as the MWHC Recruitment Facebook page. And again, thank you, and share this with friends and tell them about our opportunities. Have a great evening. Thank you.
Thank you.